Hello everyone, myself Dr. Namrata Vithalani. Today I have recorded this video to give you information about a group of oral hypoglycemic agent, that is the SGLT2 inhibitors, that is the sodium glucose co-transporter 2 inhibitors. So there are two varieties of SGLT receptors, that is the SGLT1 and SGLT2. Majority of the glucose reabsorption in the kidney, in the proximal convoluted tubule, it is contributed by the SGLT2 receptors, which is inhibited by the SGLT2 inhibitors. The common drugs which we use is the remogliflozin, dapagliflozin and empagliflozin in this category. So in the normal individuals, the renal threshold for the glucose reabsorption is around 180 milligram per deciliter. Now, these SGLT2 inhibitors, by inhibiting the SGLT2 receptors and inhibiting the glucose reabsorption, they lower the renal threshold for the glucose reabsorption to the 70 milligram per deciliter. So, by inhibiting the SGLT2 receptor, that lead to the glycosuria. That is the predominant mechanism of action of SGLT2 inhibitors. So, because of glycosuria, it may lead to the increased risk of the vulvovaginal and urinary tract infections. So, patients should be screened for the same thing. Because they lead to the glycosuria, they lead to the weight loss, they lead to the reduction in the systolic blood pressure, and the studies have shown that there is an cardiovascular benefit when started in individuals with the diabetes with this SGLT2 receptor. Another interesting thing is that their mechanism of action, it is independent of insulin secretion. So this novel mode of action, when the conventional oral hypoglycemic agents which we use commonly as a first line like sulfonylurea, they lead to the increase in the insulin secretion. So over a period of time in diabetics, when the adequate beta cell mass is not present, they may not be effective. In such individuals, this SGLT2 inhibitors, it is very beneficial. In diabetic individuals with obesity as well as cardiovascular risk, they are very helpful. But we should be cautious in individuals more than 75 years of the age and GFR less than 30 ml per minute. Thank you.